Next, we're going to describe the intensive care unit. What types of patients need to come to these settings? So an intensive care unit is where care is intensive. That's where people need one-to-one care or one-to-two care, and what that means is one staff member per one patient. So the types of patients you might see in intensive care are people that have had a severe motor vehicle crash, been exposed to some sort of trauma, perhaps fallen from a large height, and even those that are severely intoxicated with drugs or alcohol. So patients may also be there post-operatively, and they require one-to-one care in the period after they've had significant blood loss or just in that first recovery phase, just to make sure they're okay. The intensive care unit is extremely expensive and around about costs $5,000 a day. And that does not include things like X-ray, pathology, and all the diagnostic tests that will be required while you're there. Depending on which intensive care unit you're in, there are different capabilities. So some will be very specific to, say, cardiothoracic surgery, where others in the rural setting might be more tailored to making sure somebody's okay for that first 24-hour period, but then they're going to have to get transferred to a large teaching hospital. There are different types of intensive care units, and we're going to step through each one of those now. A neonatal intensive care unit is designed for the neonatal child that might have been born prematurely or has just been born. The skills of the nurses in those units are quite extraordinary. The next unit is the paediatric intensive care, and they look after children, but they have a wider range of patients that they care for. So it might be from the baby to the teenage years. A psychiatric intensive care unit is a really interesting unit, and this is designed for people with a mental illness during their acute phase. So this is where there needs to be more nurses around and a higher staff to patient ratio to make sure that these people are cared for in this psychotic or in their acute phase. The coronary care intensive care unit, as we alluded before, is for people that have had major cardiac surgery, open heart, and they need a lot of care post-operatively. The PACU, or the post-anaesthetic care unit, is designed for those that have just had an operation, so they're watching for things like bleeding or any complications from an anaesthetic. An HDU, or the high dependency unit, is sort of the step down from the intensive care unit, and that's to make sure that people are starting to regain their normal activities of daily living. This now leads us to staffing in the intensive care unit. Staffing in the intensive care unit is much more concentrated than on a normal ward. So depending on how sick the person is, will depend on how many staff they need. So usually someone that can't breathe on their own will have a whole staff member looking after them during that shift. It's very, very hard to predict and work out budgeting around intensive care because it really depends on what sort of patient you have in there. Equipment in the intensive care unit is also hard to predict depending on what the patient actually needs. So for example, if somebody needs dialysis, that equipment might need to be brought in. The intensive care unit, as we've discussed, has very complex patients, and so the handover from one shift to another really needs to be looked at. This can take a great deal of time as people really need to go through the whole head-to-toe assessment when they're handing over. So this is where they'd start at the neurological system and work their way down. So that might include things like their neurological observations, that is their level of consciousness, as well as all their drips, all their lines, their urine output. The intensive care has equipment that can even measure things such as not your normal blood pressure, but your arterial blood pressure, even how much blood flow goes into each chamber of the heart. So those minute details really need to be handed over so that the next shift can make sure they don't miss any tiny changes that are happening to that patient. Patients that require mechanical ventilation have a wide range of things that they need to be handed over from one nurse to the next. So think of the ventilated patient, that is someone that has the tube down their neck for their breathing. You need to monitor their gases, such as their carbon dioxide output, as well as their level of sedation. So together with all the different lines and all the medications that keep them paralysed and keep them from stopping breathing against the machine, it's really important that the next nurse understands exactly what's going on.